Welcome at the instructional video for the International Pediatric Mitochondrial Disease Score. Please watch this video carefully and practice the scoring system at least twice to be able to complete the score as reliable as possible. For more information, you can also read the manual. Thank you very much.
Domain 1. The first domain is obtained by taking the history. Please explicitly ask for the abnormalities if parents report the item is normal. We will give an example.
So how well can your daughter perform exercise?
Well, she's very good at playing field hockey.
So she's not limited in playing sports
No.
compared to peers?
No.
And able to participate in school gymnastics?
Yes, normally.
Domain 2. The second domain is the physical examination part. In case of asymmetrical abnormalities, please score the most severely affected side. Here we will give some examples. Detailed instructions can be found in the manual. Please remove orthoses and corsets if possible. Item 6, 7, 8 and 9. During the eye examination, the eye movements are assessed and the eyes are checked for nystagmus, ptosis and strabismus. Individuals with strabismus have an eccentric light reflex when focusing on the light. In patients with ptosis, the eyelids are drooping over the pupils. Physiological nystagmus is normal and therefore rated as 0. During the vision testing, item 10, the child is allowed to use both eyes and glasses if necessary.
Nou, kom op dan. Even kijken.
Proximal muscle strength, item 10, is tested in the biceps and the quadriceps muscle.
Oké. Ja, maak je been maar recht. Druk maar. Harder, 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 harder. Nog harder.
Distal muscle power, item 12, is tested in the tibialis anterior muscle and by assessing grip strength.
Ja, en knijp maar zo hard als je kunt. Harder, harder. En een rechte lijn. Zo, mooi voetje voor voetje.
Ataxia, item 15, is tested by the heel toe.
Heel goed.
By alternate movements, top nose and the ability to sit. You see the examiner is allowed to give an example of the intended movement. Deep tendon reflexes of the knees, elbows and ankles are tested in item 17. The muscle tone during the full range of motion is assessed in item 18. Item 19 assesses hypotonia. The child is held under the axillae and placed in sitting position without back support. In older children, the tone is assessed during passive movement of the arm. The sensory examination in item 20 is performed using a tuning fork and subtle touch, and the child is asked to respond if he or she feels anything. If the child is not able to indicate this, the response to the stimulus is noted. As always, in case of doubt, please note this on the form and check in the manual. The third domain includes the functional tests. In this domain, the reason why the child is not able to complete the item, for example intellectual disability, muscle weakness of ataxia, is not relevant. The investigator is allowed to give an example of the indicated movement or to show the movement by moving the child's limb in the intended direction at every attempt. A total of 3 attempts is allowed. If the child uses tricks to complete the task, these are rated as compensatory or abnormal movements. If the child refuses to execute the item is not safe to execute, or the child is not able to maintain the starting position, the item is scored as a 5. Please note, not safe or refusal on the scoring sheet. Please also take note of the importance of adequate back support during some of the fine motor tasks. Item 2. Head control is tested with an adequate back support. At least 3/4 of the back should be supported, though not higher than the shoulders. If necessary, the investigator may position the head of the child above the pelvis, and the ability to remain in this position is scored. The ability to roll over, item 3, is tested bilaterally. The ability to sit up from a supine position is tested in item 4. If the investigator assumes that the child is able to perform better, a total number of 3 attempts is allowed. The ability to stand up from a chair is tested on a height-appropriate chair. The following tests are performed in a corridor that is at least 2 meters wide. Standing, item 7, is tested on a hard surface. The investigator is behind the child to guarantee safety in all tests, if indicated.
Goed zo.
Ja, sneller.
Pak wat andere beentje.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
The child is sitting stably in a chair with adequate back support for the items 11 to 13, assessing the ability to reach and grasp.
Leg ik hem op tafel neer. Pak hem maar. Ja, geef maar terug. Oké, leg je weer op tafel. Pak hem maar. Ja, leg maar zelf neer. Mag je met de andere hand
Complex
pakken.
motor function is tested by rotating a pen in the hand.
Zie je? Probeer maar.
Je mag er ook de beweging voor doen.
Thank you for watching this video and lots of success with the testing. Of course, if you have any questions, please feel free to contact us. The contact details of the Nijmegen Center for Mitochondrial Disorders are present on the questionnaire.